Here with us to discuss that and other health headlines is Dr. Mike Sevilla. He is a family physician at Salem Family Care in Ohio. Dr. Sevilla, welcome.
Great to be here. Thank you.
Let's talk about Bella Hadid. She put a spotlight on the suffering one goes through with Lyme disease. Those pictures are heartbreaking. She looks like she's in a lot of pain. How does someone become infected with it, and what happens if this disease isn't treated?
Well, people become infected with Lyme disease just by bitten by a tick. It's very, very small that people may not even be aware that they've been bitten by the tick. And some of the early signs and symptoms include things like fever and headache and fatigue and joint aches and also a rash. And there's a rash, it's a target lesion, and if people have that where it's red in the center, go to your doctor immediately. But if these Lyme disease symptoms go untreated, then later symptoms can start. And these symptoms later include things like nerve pain and arthritis and joint pain, facial palsy, heart palpitations, and sometimes even short-term memory loss.
Is it ever too late to treat Lyme disease? Because you mentioned it's a small rash. I can see how people could miss that.
Yeah, the best time to treat it is early on in the disease.
Sure.
But if it is left untreated, then it can progress to those later symptoms that I talked about.
I do want to talk about another bug becoming endemic across parts of the U.S. It's called the kissing bug disease. Doc, what are the symptoms and why is it a problem now?
Yeah, these bugs, they bite your face, which is like not really fun.
No.
And it can cause swelling. And it can even cause swelling in the eyelid, causing the classic like Ramona sign, which is not very fun. But other symptoms that could be things like fever and fatigue, body aches, rash, loss of appetite, diarrhea, and vomiting.
What precautions can American families take against getting the kissing bug disease, Doc?
This bug kind of is active at nighttime, so sealing up the cracks and doors in your walls, installing window and door screens, and even consider contacting an exterminator for this condition.
All right, good to know. Let's move on. I want to talk about the largest cause of heart attacks in people younger than 65. This especially affects women. Doctors now say it might not have to be the plaque buildup that is causing heart attacks. What is the new thought process here doctors are becoming aware of, and what would you tell patients, especially your female patients, about this, doctor?
For diagnosis of this type of condition, it's not traditional type of a heart attack, especially found in younger women. And we're not really sure why that is. But if anybody, especially younger women, if they do feel like these chest pain symptoms, definitely need to get it checked out immediately because it may be one of these more non-traditional type of heart attack conditions.
And we don't know why it seems to be affecting younger women more than men?
It's still under study, but at least we know that there are some non-traditional types of heart attacks. It's not always caused by cholesterol buildup. So if anybody has chest pain symptoms, definitely get that checked out immediately.
All right, thank you for that. Lastly, I want to talk about supplements. Doctors are saying vitamin B3 may help prevent against certain kinds of skin cancers. Talk to me about it.
They did this great study where, they're taking vitamin B3, 500 milligrams twice a day. And they did this study where people who have already had skin cancer, they take this and to prevent future skin cancers. It's really interesting with vitamin B3. We don't know if people who have never had skin cancer, if it's benefit for them, but anybody who've had previous non-melanonic skin cancers, maybe think about taking vitamin B3.
All right, all good advice. Dr. Mike Sevilla, thanks for coming on today.